to end up where we are now, which is where you have a whole lot of people who are wonderful doctors, just as competent, just as intelligent, just as adept as any surgeon, but we're valued less because of the way the system was set up.
Dr. Brian Dixon, welcome to PedChat. My first question for you is, what did you want to be growing up?
Oh, that's a really funny question. I knew that I wanted to help people. I didn't know that I wanted to do it as a physician. So growing up, we didn't have a lot of money, grew up pretty poor in the grand scheme of things. And I just hated feeling bad. I hated, I would get these allergy attacks and it'd be super, super terrible. And so I said, I want to help people when I grow up not feel this way. And so as a result, I went into the helping profession. So I knew it was going to be some form of helping, just didn't realize it was going to be a doctor.
Tell the audience what your book is called and if it's released yet, when it was released, and where people can buy it, and also how people can get involved.
Absolutely. So the book is called Forget Obama, Trump Ignored, Volume 1, Healthcare with an exclamation point. How to lower healthcare costs and restore our collective sanity. So that's the name of the book. It's actually on Amazon. You can order it right now. The way to get involved is to buy the book and then talk about it. So if there's one thing that I laugh about is that every single person that I talk to in my clinic, on the talking circuits, everybody hates the way the healthcare is financed. And we're all looking for answers. And the problem is we're looking for answers in the wrong place because we keep asking the wrong question. And the question isn't, how do we get healthcare coverage for everybody? Because coverage doesn't actually equal care. The question is, how do we put money into everybody's pockets so that they can buy their care directly from whomever they want? And so if you want to get involved, buy the book, read it, and then take it to a book club, take it to a Bible study, take it to a college class. Talk about it over Thanksgiving dinner table.
Let's jump into your healthcare reform concept then. Every state sets up a nonprofit. Everyone that's 18 or older is a shareholder of that nonprofit company. And then there's a board for each state that's comprised of 60% physicians and 40% non-physicians. And physicians probably isn't the right word, just healthcare people, right? Healthcare professionals.
Correct.
And then you have this board creates a standardized price guide. And there's as a result, a standardized fee for preventive medicine. And we can get into preventive medicine later. And then additionally, there's one universal EHR. So those are kind of the layers right there.
Yeah.
I like the concept of the state owning this versus the national government or the federal government. Did I do a good job summarizing that?
You did a fantastic job. I'm really impressed. Everybody understands the concept of Sam's Club and Costco. And so when I say nonprofit company, I want you to think almost like a state-based health Costco or a state-based Sam's Club, where everybody in the state pays into the system, because that concept really resonates with people. When you pay into something, you tend to value it. When you don't pay for something, you don't value it. And that's one of the key tenets to the whole plan, to make sure that healthcare is accountable, the system is accountable to the person, but also for the person to take more responsibility and accountability in making the system work.
What happens if let's stick with pediatrics. So what happens if my child breaks his arm and we have to go to the ER?
Yeah.
Under your healthcare reform plan, it's there's standardized money that you put in, as you said, for preventive care. But what happens if my kid breaks his arm and we have to go to the ER?
Good question. So the first tenet or the one main idea I want you to always keep in mind is that it doesn't make any sense to deny or restrict or make access to care difficult for kids, because they are our future leaders. It's actually against our best interests to disincentivize the use of healthcare for kids. Now, with that said, the plan creates a safety net, kind of a preventative care safety net. So when you're taking your child in for immunizations, the well child visits, that sort of thing, that basically comes out of the health fee that you pay every single year. When it comes to emergency care, you'll just pay that directly. So just as if your kid had strep throat or if they broke their arm, you're just going to take them in. You can take them into an orthopedics or office, or you can go to urgent care, and they'll just have a list there. Hey, if it's a fracture, then it'll be this much. The X-ray is this much, and the orthopedist consult will be this much. And so you'll just know that. Everybody will still be encouraged to have catastrophic care, but when you think about it, that's not a catastrophe. It's just a fee. And so, and then the way that we keep prices down is that all of the orthopedists and all of the urgent care treatment centers, they will compete with each other, and that's what's going to keep the cost down. So it's not going to be, $1,000 for this when you can go to a family doc or you can go to a pediatrician's office and they can splint and do everything for, $75.
Why do primary care physicians make less money and work far more hours than other physicians?
Good question. So there's a whole field called behavioral economics, and while I am not a self-ascribed student of behavioral economics, I'm a behaviorist because of what I do for a living, and then I'm an economist just because I run a business and I have to make payroll every 2 weeks. So when I sat down and I thought about it, and then I began to look back. It took me a long time to recognize that me as a psychiatrist, that I have worth. And so when I set my fee schedule with my private practice, I had sat down and I asked myself, I said, well, how much do I charge for my services? And I looked around and I compared other people's prices, and then I picked a price. And it dawned on me that that's how prices are set everywhere. Is somebody just pulls a Starbucks, they may have lots of actuaries, but they just pull the price out of there and they put it down. And so then it made me wonder, well, then how is it that my time has been valued less than a surgeon's time? Because if you do surgery, they get paid a ton of money. Well, then when you go back and look, and the person or the entity that basically set that fee was Medicare. So when the Center for Medicare and Medicaid Services, CMS, back in the 60s, came into being, they sat down and they had a big old powwow, and they basically decided what the reimbursement rates for things were going to be. And they reimbursed procedures more than non-procedures. So procedures meaning like injections and surgeries, anything that is invasive, meaning you're going to break the skin. Or you're going to apply some type of mechanical thing to the skin, be that a cast, be that EEG, CT scan, that sort of thing. And so what that does is over the course of 60 years, you're going to have people who go into those fields because it just garners more money. And of course, when you build a whole system on that, you have a whole commercial insurance system that then jumps on the bandwagon. It really just drives up that cost and drives up that reimbursement. So it's great for people who do procedures, but then it absolutely annihilates the rest of us who don't do procedures, because I'm terrible at dexterity type things. That's not my forte. But as a result, then I start to believe that I'm valued less, and then patients think I'm valued less, and as a result, not only do we not make any money as people stop going into the field, and then that makes you end up where we are now, which is where you have a whole lot of people who are wonderful doctors, just as competent, just as intelligent, just as adept as any surgeon, but we're valued less because of the way the system was set up.
And is that one of the main reasons why preventive medicine has been deprioritized?
I would say yes. Some people call it a sick care system. So in other words, the incentive is to intervene after you're sick. There's no incentive to keep sickness from happening. And I would say that when you have that primary setup, that primary behavioral reinforcement, that's what you're going to get. You're going to get a whole bunch of sick people because you're not incentivized to actually stay healthy.
What is Together Forward?
Yeah. So when I was, it's really funny. My history is kind of strange because I'm from a small East Texas town, and finished there. And I went to Baylor University for undergrad, Texas A&M for med school, and then University of Kentucky for residency. And at each one of those spots, when I looked around at the people around me, there weren't very many Black folks. And I started to wonder, why is that? Well, number one, numbers wise, I think we're only like 12 or 13% of the population, but there just seemed to be a dearth of that diversity. And so when I got to I worked through a couple of different jobs, and I started to notice there weren't very many Black folks there either. And I said, well, I can, in order to address that problem, one of the best ways to do that is to bring it to the forefront and let's address the disparity. Well, when I started to delve deep into it, I learned that the disparity is more of an economic disparity. And so you don't see very many African Americans in quote unquote high places because it costs so much in a sense to get there. And so I created a nonprofit think tank to find ways to decrease disparity. It is all inclusive. So I don't care what color you are, what your religion, what your culture is. The important part is recognizing disparity and trying to address it. I am really focusing on African Americans just because we're so far behind in wealth building. And so, so that's what that is. It's a think tank, a 501c4 think tank that is geared towards addressing those big issues.
How have you addressed it? Give me one example.
Yeah, so one of the projects in, other than healthcare reform, obviously, but one of the other kind of tangible projects is something I call Southside Renaissance. And what it is we, the membership that has signed up, we actually live in a up and coming neighborhood of Fort Worth, Texas, and we buy property and we build houses and we inspire people to basically invest in themselves, like believe that they can do it. And through that, they build wealth because in America, one of the best ways to build wealth is through real estate and entrepreneurial investment. So that's kind of a tangible thing. And then there's kind of the more, grandiose scheme, which is to change the whole healthcare system and education finance system.
If you could go back and tell your 27-year-old self one bit of advice, what would it be?
Oh gosh, that's an excellent question. Don't worry. I don't know if you've seen that there are studies that show that people who use Facebook are actually more depressed than people who don't use Facebook. And it's partly because we as egocentric beings, meaning we can be very selfish and self-centered sometimes. We tend to think that the world is not working in our favor when we see other people have more. So other people are going on vacation. They're constantly making great food. They have great bodies. And we see all that stuff and we start to think, oh my gosh, I'm supposed to be doing that. And if I'm not doing that, I am bad or I am insufficient. And so I believed the hype for a really long time. I believe the medical hype that you have to get an employed job and you have to work 40 hours a week. And if you really care about your patients, you'll be on call 24/7, 365 and blah, blah, blah. I mean, that's a lot of hype and that's not true. There are ways to have a very healthy medical practice and a very healthy lifestyle without burning yourself or running yourself into the ground.
What is another bit of advice or piece of advice that you would tell your fellow physicians?
My advice is to get rid of your big debt. So like my credit card debt is what I'm hacking away at. Get rid of the high interest stuff and then diversify. You have to diversify. My mama and daddy didn't teach me that stuff. I mean, they're wonderful people. They're not business minded, and you have to have multiple streams of income. So that's why I, in part, wrote the book. I have the think tank. I worked with a friend to develop software that we're launching. I have a personal brand now. I'm going on the speaking circuit. And when I talk to people, they go, "Oh my God, you're doing all this stuff. How do you have time to sleep?" It's because I've cut down my expenses. And then I diversify. You have to diversify. So find a way. And then I have a part-time employee gig with the new medical school that's coming. And so you have to find ways to diversify. If you're not going to diversify, then you're always going to be beholden to somebody who can, push you around and bully you. And that's what a lot of hospitals and a lot of employee jobs do is they bully doctors. And I hate bullies.
Yeah, you almost diversify, not even for economic reasons. You diversify because you like doing multiple things. And I think doing what you like to do is very important.
Correct.
I look at people all the time who are doing the 9-to-5 job type thing and they hate it. They hate going to work. And like, why are you doing that? Start something on the side that you really like. And if it doesn't work out, then start something else after that. And
Yeah.
eventually I bet you something will work out,
Yeah. And Zach, that's one of the other key reasons why I have got to change and we have got to change healthcare finance reform is because there are so many people who are stuck in their jobs because of the health insurance. And so they sit and they're miserable for 20 years because, that's the only way that they can pay for their medications or see their doctor. And that is utter bullshit. Absolute utter bullshit. When we live in the richest country in the world, we can do better. And so let's build a system where it's transparent, people have money in their pockets, and then they can go quit their job and go start that ice cream stand, or they can go and do concierge lifestyle training because that's what resonates with them. So,
Brian, this has been an absolute pleasure. I always am like really, after conversations like this, I'm like fired up,
Yes.